do we know about dietary intervention in functional dyspepsia, or more specific in PDS? So the low FODMAP diet is a diet which is well established in patients with irritable bowel syndrome, another TGBI. And FODMAP stands for fermentable oligo-D-monosaccharides and polyols. It includes bread, but it's also present in many fruit and vegetables, dairy products, etc. And FODMAPs, actually the mechanism behind it, so they are poorly absorbed in the small intestine, osmotically active, fermented by the intestinal microbiota, which induces symptoms through increased water and gas content in the bowel lumen. Symptoms in patients with IBS as bloating, diarrhea, constipation, flatulence, and other GI-related symptoms. So actually FODMAPs in patients with IBS leads to symptoms probably through fermentation and osmotic actions. But if we want to test the effect of FODMAPs in functional dyspepsia, there are probably other pathophysiological mechanisms that might play a role. So in health, the mucosal barrier is intact, but if we look at patients with functional dyspepsia, food particles can actually lead to changes in mucosal barrier, which leads to an increase in, for example, eosinophils and mast cells. So maybe mucosal alterations in the duodenum also play a role in functional dyspepsia, and food can lead to symptoms in this way.